Prostate cancer is the most common cancer for men, and there has been great advances in the treatment of localized prostate cancer, which has led to an exciting new treatment called local therapy. Dr. B of Prostate Cancer Institute of Arizona is here to tell us about it. Good morning, doctor. How are you?
I'm doing great. Thank you.
Let's talk about this because, again, this is very important for men. Especially we're starting to see more men, again, getting prostate cancer. But you have a way to make sure that they can recover, be back to work in plenty of time, right?
Yeah. So first of all, the traditional treatment for prostate cancer is usually to treat the entire prostate. However, now with advances, we can actually just now treat just the only cancerous portions of the prostate. That's what we call focal therapy. And so by only treating the cancerous portions of the prostate, we now can spare a lot of the unwanted side effects that typically happen when you treat the entire prostate, such as incontinence or impotence. So this is a major advancement.
And this is something that we know that's very important for when it comes to treating prostate cancer, because everyone gets different prostate cancer. We have to make people understand that.
Yes.
This is for when it's really focused in on a certain area, right?
Exactly. So these are the most earliest stages. So, with advanced screening now, we're able to identify prostate cancer much earlier. And so for these men that have, a minimal amount of cancer detected from their biopsy, they can be candidates for focal therapy. And for me, I use brachytherapy to provide this focal therapy, where I implant just the radioactive seeds just in that cancerous portion and preserving the normal parts of that prostate, and thereby minimizing side effects. Yeah. And these men really breeze through this treatment.
So I like that. And then what's very important too is about getting back to work, because that's what some men worry about, getting back to somewhat of a normal life after having a procedure like this.
Yeah, I have men going back to work the next day, continuing their activities of daily living, can even continue to actually be even sexually active. So it really is minimal downtime.
Yeah, and the most important part is getting checked, and that's what you always tell men to do. Get checked, and actually it's starting to be checked at a younger age too.
Yeah, no, like I said before, with advanced screening for prostate cancer, we're able to find it much earlier and to treat it much easier. So screening is definitely very important.
Yeah, and we have to talk about, of course, the Prostate Cancer Institute of Arizona, is that you've been doing this for a while. You knew about this kind of procedure way back, but now it's starting to really come back again in a bigger way that you want to help men.
Exactly. The low-dose rate brachytherapy that I've been doing for 20 years has now become much more available for men that want this option. And that's really the whole mission of my institute.
Yeah, and also it's another mission of yours, and that's making sure that people are taken care of, because you've just got a nomination, didn't you?
Yes, yes. Yeah, I was fortunate enough to be nominated for the Phoenix Magazine Top Doc, and feel really honored.
Yeah, so well, you got to come back when you get that award, 'cause I know you will, because again, you've been helping men for all these years be able to take care of their prostate cancer and get back to, again, a full life and doing things, which is so important.
Thank you.
So thank you. And of course, you want more information about the Prostate Cancer Institute of Arizona. Information's right there on the screen, or you can head over to AZTV.com. So thank you, doctor. All right, when the mix returns, see how you can get rid of your wrinkles in only 10 minutes. I like that. Come on back.